Welcome to CHPA Chat, conversations in the consumer healthcare industry with Anita Brickman.
So, have you ever wondered how DSHEA became the regulatory framework for the dietary supplements industry? Well, we're going to answer that question. Join Patricia Knight, Scott Bass, and Loren Israelsen, three of the people who advocated for this legislation way back in 1994, as they share personal stories on how they got this done and why the industry can benefit from its modernization 27 years later. John, take it away.
Thanks, Anita, and thanks to our listeners for joining us in a CHPA Chat podcast. This series of dietary supplement-specific discussions is going to be a really great one. And I have to say, I've been looking forward to this since we had a chance to schedule this thing. And we're going to talk about DSHEA. And for those of you who are fully engaged in the dietary supplement category, you've heard DSHEA modernization or DSHEA 2.0, and we talk a lot about that. But we thought it would be really helpful for our listeners in particular to go back and look at, well, what was going on in 92 to 94, and DSHEA 1994 happened, and how did it happen? Today, there's an estimated 70,000 products on the market. An estimated 70% of Americans use a dietary supplement at least once during the course of the year. But back in 1990, believe it or not, there were only about 4,000 products, only about 500 companies that were selling products. And back then, only an estimated 40% of consumers were using dietary supplements. So in the last 26 years, we've experienced this explosion of growth in a category that actually makes a big difference in the lives of the consumers that use the products sold. So we went back and revisited what happened in 1994 in particular, and who were the key drivers that helped facilitate and even accelerate the introduction of the legislation and pulled all the levers to make it come alive. And I'm so excited and proud to be sitting here with three of the most influential people that completely changed the trajectory of the dietary supplement category in America, if not the world. First, we have Loren Israelsen, who is the president and CEO of, back then, it was called the United Natural Products Association. At that time, Loren, you were a former staff member of Orrin Hatch, and I think running the state of Utah, his office at that time. Today, you're still, by and large, you're still involved in the industry as CEO and president of UNPA, now called United Natural Products Association. So welcome. We have Patricia Knight, who back then was the chief of staff for Senator Orrin Hatch. And for those of you not around in 1994 or following the category, Senator Hatch was the main sponsor of the bill. And Patricia was the person on his staff that actually pushed it through and made it happen. Today, she's still actively involved in the dietary supplement category and runs a government relations advocacy firm. So Patricia, thanks for being with us. And Scott Bass, who's currently the partner in charge of life sciences for the law firm Sidley Austin, and back then was in private practice still, but representing a large number of industry interests. And Scott, welcome, and thanks for joining us. So the three of you in 1992 to 94 worked pretty closely together and really orchestrated it all. But let me start, Loren, with you first, and maybe you could paint the landscape for our listeners on what brought about the opportunity to push through DSHEA at that time, and how did you get it done?
Well, John, thank you for the chance to bring Trish and Scott and I together. That is always a pleasure. Trish works closely with UNPA as our senior political advisor, and Scott and I stay in regular contact after all these years. So we are not only colleagues, but we are real friends. So we go back into this, the pre-DSHEA era. It was somewhat medieval in terms of what was going on as an industry. We were in dark times. We should actually roll it back further, is that the DSHEA period was just the latest in a series of these sorts of legislative battles that had started as early as the 1930s, and then again in the 1970s. There will be some that will recall the Proxmire Amendments of 1976. That created a category to try and help protect nutrients that were otherwise, FDA was trying to drive them toward OTC drug status, and they would have lost their dietary supplement status if that word existed then. So there was a ramp up long before 1992 when the first DSHEA bill was introduced, which was actually called the Health Freedom Act. We decided we needed something had a little more sizzle, a little more clarity of meaning to both attract the audience of consumers that were very concerned about their access to supplements. But here are some of the things that happened. In 1990, Congress passed the Nutrition Labeling Education Act. Turns out it was a very good piece of legislation, but it did one thing that really was a problem for the supplement industry. It created nutrient content claims and health claims. This was all based on disease-nutrient relationships. So a new class of claims were created, but you had to be a nutrient. No nutrient, no claim. And then nothing else was permitted. Well, that knocked out a whole lot of dietary ingredients, especially the herbal product sector. They were in big trouble. Then there came the Dijkstra report, which was the infamous report that was initiated by then Commissioner David Kessler. And this was to examine what would FDA do if it were to start over and establish a regulatory regime for dietary supplements. Well, at first, that was going to be an internal report. News leaked out that it was something was going on, and under tremendous pressure, when the report was done, it was released. And to not our surprise, because we thought that there would be bad news. Indeed, FDA basically said, we think that herbs are drugs, so are amino acids. Nutrients are okay, but pretty much everything else should be treated as a drug or a food additive. Then we had the Jonathan Wright FBI raids. This became an infamous moment that many people today probably have never heard of. But this was a drug bust. This was a bust, not a drug bust, of a naturopath, a medical doctor in Washington State that was giving B12 injections. And literally one day, the FBI broke the door down, flak jackets, guns in hand, everybody on the floor, and he was charged for giving patients B12 injections. So there was a series of things that were going on that became ever more alarming. I am based in Salt Lake City, Utah. I've been here for many years, and as many know, Utah's really was a geopolitical center of the industry for many years and continues to be. So in 1991, late 91, I called a number of our company executives here locally and said, we really have to do something. There were a growing number of raids against individual products. The tensions were rising. NLEA had passed. We had gone to FDA in a series of meetings that included Scott, and many others were involved in talking to FDA, to no avail. They were not interested in hearing about our concerns and said, if you don't like what we're doing, go talk to the Congress. Good idea. That was the impetus for DSHEA, literally, was FDA said, we're done talking to you. Next stop is Capitol Hill. So we put our thoughts together, and here we, like other groups, were developing thoughts and had a legislative draft that we thought could be the beginnings of what could be legislation. I met with Senator Hatch, and he quickly agreed to support this idea. He said, get yourselves a Democrat in the House, and let's get going. So that's an abbreviated beginnings, but there was a lot of ferment and a lot of fear. There was a lot of confrontation, and it was really ripe for something to happen. And as we know now, it became one of the greatest populist movements as it relates to legislation that we have seen in modern times. And a quote that many have heard, which is true, is that there was more constituent contact to Congress around DSHEA than anything other than the Vietnam War in the memory of Congress at that time, back in the 1990s.
Wow.
That's quite an extraordinary statement, given all of the other things that were going on.
And just to tease out what some of the key facts of what Loren's saying is, there had been this decades-long history of animosity against dietary supplements by the FDA. They really didn't know what category to put them in, how to regulate them. Unapproved drugs, food additives, foods. There were court cases Scott can talk about if he cares to. So there was a lot of turmoil in how the products were to be regulated. the interesting part about that is because of Loren's background in that, the fact that it was such a huge industry in Utah, and the fact that Senator Hatch was positioned as an advocate because he personally believes in dietary supplements, he believed in health freedom, and he was on the relevant committee, the Labor and Human Resources Committee, that had jurisdiction over the FDA, that this all came together just at that precise right moment.
But Patricia, tell us though. So, Loren kind of got everybody organized, primarily in the state. As you said, Loren, kind of the epicenter of the dietary supplement industry largely was in Utah and Utah-based companies. But so it landed in Loren Hatch's office, and then it was the chief of staff and a staff member, Patricia Knight. And so I can only imagine, tell us a little bit about that personal side of the story, though, Tricia. It's like, how did it land on your desk, and what did you think? Did you think, oh, this is going to be awesome? Or oh my God, what did he create? I mean, how did that happen?
Well, I started in Hatch's office the day after Clinton was inaugurated, and I had been working at HHS in the legislative office. A friend of mine, Ann LaBelle, was staffing Hatch on this, and so she would call and ask me questions about information the department had about dietary supplements. Very interesting that there wasn't anybody who was really, aside from FDA regulators, anybody who knew anything about dietary supplements, and that was where we ended up putting the Office of Dietary Supplements at NIH, is to try to build that body of knowledge based on that experience we had then. But so I started as a volunteer. Quickly saw that this was something Senator Hatch was passionate about. I got promoted or hired, and then Ann left to go over to the Ways and Means Committee, and I became his health policy person. So all of this supplement stuff landed in my lap, and I have to say it was really frightening because I knew he cared so much about it personally. So complicated, the history, FDA regulations, FDA law, and that's where I think Scott and Loren came in. They were so helpful in helping inform us about the intricacies of the law, where FDA might be pushing things, where things need to be clarified. But I was scared to death when I first inherited this because I knew how much Senator Hatch cared about it.
Oh. What is the background, by the way, with Senator Hatch's interest in advocacy for dietary supplements? And by the way, the second part of that question, if you'd answer it, is who's going to replace Senator Hatch, as we move forward as a category and as an industry?
I say this fondly. He's a health nut. I mean, he exercises. He would come in every morning at 5 a.m. and do Stairmasters at the highest level for an hour. He was very into supplements and had been for years, probably decades, and how each one worked and what it would do. And he studied that, and it was a personal interest. And of course, that aligned with the fact that it was a huge industry in his state.
Wow. Is there anybody like that currently in the Senate or in the House? Or
The closest one, I believe, is Kirsten Sinema, who is now a senator, was a House member, and unfortunately not on any relevant committees, but she's been out to UNPA a couple of times. She's met with our members. She's very she's a runner, a sports enthusiast, and she is really knowledgeable about supplements.
Great. So Scott, you basically kind of grew up in the dietary supplement industry long before 1992. Your earliest experiences in the law was involved in the dietary supplement category. But to tell us, where were you in 1992, and what were you doing, and what was your first interface and recollection of getting this? And tell us a little bit of, if you would, as you tell us your story.
Well,
how did you meet Loren and Tricia?
Thank you, John. I met Loren, who has remained one of my dearest friends, and so has Trish. I met him in 1990 because I was the general counsel of the largest trade association at that time, the National Nutritional Foods Association, which represented thousands of retailers. In those days, most of the products were sold through very militant and enthusiastic retailers. And interestingly, you used the word epicenter to describe Utah at that time. It was actually the epicenter of the DSHEA effort, but only one of the three centers of the dietary supplement industry. The supplement industry actually started in Chicago in the 1930s, moved out to California in the 60s, and then New York established an enterprise zone, meaning people could save money, in the 1970s, where most of the industry congregated. So it was New York, Utah, and California. But just to put a little color on that, I had not known Loren. I knew of him, had met him, but we became dear friends very quickly, working together on NLEA, because that 403R5, the provision that Loren referred to in NLEA, which said that FDA can create different health claims for supplements under a different scientific standard. And then I remember very well to this day calling Loren. We were representing different associations, but in December of 91, as Loren described, I said, Loren, this is the shot across the bow, isn't it? He said, you bet, Utah's rising. And so that's really, John, what happened. And Loren and I have worked together closely since, really, and have remained, as he said, very dear friends. I met Trish in one of those 2x2 square rooms in the Senate office building the first time, and I was blown away at how much she knew, and also her strange sense of dry humor, which has also persisted. And Loren and I worked with her through the end, and I think the story that Loren and I both love to tell is at the very end, with her leadership when the bill was about to die, a week before it passed, they squeezed, as usual, 900 people. No, it's 12 people into this little room that sits 6. We were forced to spend 8 hours straight in an airless room. And my, outdoors macho friend from Utah, I said, you want to share a sandwich? He said, no, I'm good. So, 3 hours of the meeting, the guy was dying. I just surreptitiously slipped him half a sandwich, and of course we went on to get the bill out the door with Trish's and other help. But this is the kind of thing I participated very actively as the general counsel of NNFA and met 100 times with Loren, Trish, FDA, et cetera, and industry. And it was a very interesting point, John. People don't know, then leading trade association, not the biggest, but the leading one in Washington, actually tried to kill the bill twice, something that's not known. And so, well, I think we can keep that out of discussion now, but let's just say that somebody got a large bonus for passing a bill when he was instrumental in trying to kill it twice. And Loren, Trish, and I would talk about this and say, okay, this is politics as usual. So in addition to the stories Trish will tell you about how it passed, or Loren about the constituents, I think that's the most colorful part to me, other than the friendships and also the failure, success, that meeting Loren and Trish, you remember, in Congressman Richardson's office in September of 94. You may remember that, when it was supposedly all over. So it was an up and down process that actually extended past the closing of the Senate, which they can tell you about.
Let me talk a little bit about the process, because that was really an education for me, although I'd worked on the Hill and around the Hill for a long time. Senator Hatch had worked with the principal people who would be in the Senate. Senator Kennedy, Senator Harkin, of course, came early on and helped immeasurably. And in the House, it was John Dingell, the longtime chairman, powerful Energy and Commerce Committee, and Henry Waxman, the chair of the Health Subcommittee. And Hatch had done a number of bills with them. He had been the chair of the Labor Committee in the 80s, and so he knew how to work with them. And he said, I give him total credit, he said from day one, I know Henry Waxman, he does not want this bill, and he will string it out till the very end, but we'll make a deal. So his strategy in working with Senator Harkin was to get a bill drafted, and then we worked with Congressman Richardson to have the same bill drafted on the House side, and then to solicit co-sponsors. And he meticulously went to the floor. He had a clipboard. He would go up to people, are you a sponsor of this bill yet? Let me tell you what the FDA is doing. It's bad. It's very bad. At the same time, FDA was in an interesting position because David Kessler, the FDA commissioner, had been a staffer of Senator Hatch's. And so he had a great deal of respect for him and didn't really want to take him on in the open. So FDA was through the Democratic staff on the Hill trying to offer suggestions on this bill, but not overtly working with us. So we started with this bill, and Hatch and Harkin meticulously got co-sponsors until they ended up getting a majority of the Senate and a majority of the committee. And in the House, Richardson was able to get a majority eventually of the House, the subcommittee, and the full committee, yet Waxman still wouldn't bring it up. So Hatch went to Kennedy and literally followed him around the Senate floor till he would talk to him, and he asked for a hearing. And so Kennedy gave him, they had a great relationship, and that was another key element here. He gave him a hearing. The Democrats controlled the committee then, but Kennedy was very deferential and let Hatch ask all the questions he needed to. And I remember it completely because a couple months earlier, Waxman had a hearing with David Kessler, and Kessler had hastily put together this report where he had CSOs go to stores and find products that he said were a problem. We had an idea. We did a staff report of that report, and we pointed out the tremendous amount of errors in what FDA had done. And we issued a report at the hearing called False and Misleading, which kind of took Kessler threw him back on his heels. And like one thing FDA had cited as a supplement was a book. There were a bunch of stores that said they didn't even sell what they were cited as selling. And it made a big splash. And I think after that hearing, Jeff Bingaman was a senator from New Mexico, came on board. He said, I see now that the FDA is not playing fair with this industry. And he was the one person we needed to have a majority of the committee being co-sponsors of the bill. So then Hatch kept working with Richardson, more co-sponsors. He went to Kennedy and said, I need a markup of this bill. We got to bring it up. We got a markup. Kennedy felt that he had to offer a substitute, and he got, I can't remember, it was 2 or 3 votes, and it was reportedly the first time he had lost, and maybe the only time in his own committee, and our bill was reported. And then Hatch and Harkin went to Kennedy and said, we've got the bill now, let's bring it up on the floor. And at the same time, Waxman is saying, no, don't go so quickly. But Kennedy was like, I can't hold Hatch off. And so he had the bill brought up, and they allowed Senator Hatch to bring it up on the floor by unanimous consent, and it passed one night by unanimous consent. We had a dormant period where we tried to work with the House and identify issues that had to be worked out. And things didn't really go that well. And we got to literally the end of the Congress, the last day, and Richardson's staffer called me and said, I just saw Bill Schultz, who was Waxman's counsel, in Ledge Counsel, and he says we'll have a new draft by the end of the day. And we're like, what? So they gave us a draft, and it really contained the framework that we wanted. The members hastily convened a meeting, as Scott alluded to, in Congressman Richardson's office in the Capitol because he was in leadership. And literally the final bill was negotiated by Dingell, Harkin, Hatch, Waxman, Kennedy. And things happened there, like the imminent hazard authority we offered to add because Dingell was still a little worried that unsafe products could still be on the market. And Waxman literally wrote the disclaimer that it has to accompany a supplement. This is not intended to blah, blah, blah. Waxman wrote that at that meeting, and that was put in. So we raced to Ledge Counsel to get the changes put into legislative language. It was Waxman brought it up on the floor that night by unanimous consent, and Hatch brought it up the next day, the last day of the Congress, by unanimous consent. And it ended up being one of only a couple of bills, health bills, that was enacted that year. And that was the year that the Clintons were pushing the Health Security Act. So it was a big contrast.
Oh, that's amazing. Loren, what one or two points of the bill do you think were the hardest to get, yet the most important even today? And the work that Tricia described was just incredible. But what were really the key points that you were trying to advocate for industry that you're most proud of or pleased that you got it in?
I would say by far the most significant was amending Section 201, the definition section, which is food, drug, and now you have dietary supplement. And we were told at the beginning, I recall John Dingell saying, you will never get 201 status. That's a big deal. And so where you see the definition of dietary ingredients, which is so broad, is one of the key issues. If there is a DSHEA 2.0, we can imagine that the agency would like a relook at that broad definition. But it was broad by intention, is because we knew we would not be able to define the full class of ingredients that consumers would use in some form of dietary supplement. So that's number one by far. I think the second piece that was both critical but really complicated was figuring out the new dietary ingredient provision. That was complicated. We were trying to think through what the future would look like. How would new ingredients come to market? What safety mechanisms? There was a lot of concern among the Democrats that scurrilous things might make it to market. Well, we've seen that has happened, and that's why the NDI provision was created. The hardest part within all of that was this chemical alteration problem of trying to figure out when is something new, when has it been changed. So we had a series of meetings trying to figure that out. And I must say, on the back end, we've still struggled with trying to really understand the best way to define a new dietary ingredient. But we did the best we could with the time and the skills at hand. And one must say that the bill's never been amended, which is remarkable. And it's proven to be extremely durable. It was a really well-crafted bill. People have taken shots at it. No one's been able to amend it or sink it.
Yeah, that's awesome. Oh, I guess the other perspective of this description, Scott, for you is do you think even then that there were like loopholes that you were concerned about, that there would be workarounds that industry or unscrupulous players would try to move through? I mean, was that a concern back then, or did it become a concern, John? If it is today?
The answer is yes, but. And the but is, for example, GMP, we didn't use the same language, but we knew we needed GMP, even though a lot of industry were against that. But a number of us knew that unless we promised quality to the public, that the category could never really survive. So, John, I think, to me, the bill took off the table the theory FDA was using for 14 years, which is they said, if you put vitamin E in a vitamin E capsule, you're adding it to the capsule, and therefore it's an unapproved or unsafe food additive, which gave companies no defense. So that was eliminated from the law, and that was good. But the problem was that we didn't know, to Loren's point, John, how companies would comply, because there was such distrust on the part of industry and Congress in the way that FDA had enforced. Two courts in 1991 and 92 called FDA's theory an Alice in Wonderland theory, meaning it was just a joke. And so the way they kept good products like evening primrose oil and blackcurrant oil off the market was saying, our experts don't recognize it, generally recognize as safe. So what happened, John, is, to the chagrin, I think, of the three of us here and you, people have distorted the new dietary ingredient process, and now there are industry members and lawyers who are running it by using what they call self-GRAS, which was not available for anything other than proving a substance was used as a food. They're now using it to bypass the NDI process. So we have huge numbers of products that are unknown in terms of safety going on the market. And you have the dual problem of FDA not having enough money to enforce and therefore not having the capacity to stop this, and the problem of industry and some consultants and lawyers helping them to push a very untenable position that's not going to protect consumers. If we go from 4 billion to 40 billion, that brings a responsibility along with it to protect the safety of consumers. If we're one of the fastest growing consumer health categories in the world, we have an obligation that increases with its proliferation to provide safety. And so that's the biggest loophole that I've seen, other than mandatory registration.
There's another complication hanging over that, which is the structure of the bill, which was suggested by Waxman, is basically that there are old ingredients, grandfathered ingredients that were on the market in the U.S. The month of enactment of the bill. And then there would be new products which would go through this NDI process. And it was very important to Senator Harkin and Senator Hatch that this NDI process not be pre-approval, but that we allow FDA the time to have a look-see and make sure that they're comfortable with the safety data about a product. And I think you were going to ask was there something we wished we could have changed? And one of my regrets is that we didn't have time to be able to elaborate on how you would prove old and how you would prove new. And so we have products now that people are not using the NDI process for that are undoubtedly new, but they're not using it. And then you have this additional thing, complication Scott mentioned of companies and councils using the GRAS self-affirmation. I won't call it a pathway because I don't think it really is a pathway, but they're doing that, which is then allowing things to be on the market that maybe wouldn't be on the market if they went through an NDI. And there's just a lot of confusion about, is it old or is it new? And we really don't have a good system for telling that.
Well, it's clear that the three of you did so much to establish a regulatory framework for the category that helped facilitate the growth of the industry, right? So over the last 26 years, Scott, to your point, it's incredible what basically you guys enabled an industry to expand and to become really a credible source of products to help manage health. But along the way, there were some bumps, right? And even from the start, the FDA, you couldn't really call them supportive of DSHEA. And in 1996, I recall, what would you call them, Loren? The ephedra wars.
Yeah.
And that didn't help industry much. But tell us a little bit about that time. Like 4 years after the bill roughly was introduced, the industry was following it. Things started to get a little rough back then. And did that change the trajectory of DSHEA and of the dietary supplement industry, or it was quickly solved and the industry moved on?
Yeah, the passage of DSHEA came as such a shock to so many, ourselves included, is that we know just how close and how improbable the passage of the bill actually was that Trish described. The morning after that, as the story goes, that David Kessler opened his Washington Post and read that this dietary supplement law had passed and fell off his chair. That it shocked a whole lot of people. What it did is it number one, it validated a deeply held belief in millions of Americans that they have a fundamental right to access to natural health products. And that goes deeply into American history. So there was a massive, I would say, emotional parade that was felt across the industry. We finally had a green card. And because it was statutory, people couldn't take it away from us. The second thing is that it woke up Wall Street, that took now a great interest in this industry, and money began to flow in. And generations of companies that had been family owned began to sell. There was an awful lot of money being offered. That changed the character of the industry over time, going from private to public to venture capital. That has had a profound effect on the industry. The shift, and in 1994 is when Google was formed as an entity. Amazon wasn't far behind. So DSHEA passed essentially the day the internet began. And that transition was profound, and we see even more so today. We became a very international industry. Most of our raw materials are sourced overseas. That our supply chains are very long and very complex. DSHEA I think has been stretched in terms of how it operates in a very different world now, vastly different than we imagined. All the key documents, the drafts, the amendments that we're passing back and forth were done by fax. And to me, that's an astonishment that we were able to do the volume of work necessary using faxes and conference calls and trying to keep it all straight. The other thought comes to mind is that as much as we refer to the opposition from FDA and from other interests, there was tremendous disagreement inside the industry how this ought to go. There was a nutrient faction that was ready to sign a bill if herbs got tossed off the bus. A bill could have been done fairly easily, but the whole point of DSHEA was to protect those class of ingredients that had no protection. And so that's what the internal battle came down to. And as we saw the industry evolve, guess where all the growth came from? It was botanicals, amino acids, fish oil, probiotics, all of these other categories outside the traditional nutrients. So as we look at what it was we tried to protect in DSHEA, it was that part of the industry that has been most fruitful, that has grown the most over time.
Loren's touching on a key point there. When Scott talked about that little room, Hatch had a conference room way on the other side of the Hart building, and it was just an empty room, and we called it Norway. And we called it Norway because so many of the players in the industry were at each other's throats, disagreeing about how different aspects of the bill should be handled. And I think we have to recognize a key element of success and enactment of the law was that Harkin and Hatch were invested, and they would tell the industry, no, I don't think we can get that provision. If you insist on that, that's fine, but this bill's probably over. Or this provision has to be in there. We need something to assure people that there will be safety of these products. And their tremendous personal interest really helped bring people together.
It was very much the health freedom movement. Senators Hatch and Harkin, as Trish said, they insisted that it would be freedom with responsibility. And that's ultimately what we tried to build into the bill, was that compromise. And then there was a freedom faction that really didn't want to see any of that. They wanted a far broader right. And we felt that there would be abuses just by human nature. And that Trish and Scott and I were always in the camp of, we need to find safeguards to protect consumers. And ultimately, that proved to be true. You mentioned ephedra that became such a problem for the industry. And to this day, we'll still have people comment on ephedra as a dark spot on DSHEA and the reason it ought to be amended.
And many of the points we just touched on are being carried out today with the CBD issue, where FDA is insistent that they need to have us prove to them that there would be safety of these products, many of which they're allowing to remain on the market. So there's a little public health conundrum going on there. But the issue of the self-affirmed grass, is it a new dietary ingredient or an old dietary ingredient. All of that is playing out as part of the CBD legislation that's currently on the Hill.
Well, so here we are 26 years later, plus or so, and there are still factions, both in healthcare. There's the FDA, is still paramount, all about safety. You get the consumer who are much more engaged in dietary supplements today, and the industry finds itself talking about modernization. The FDA is talking about modernization of DSHEA. What do you guys think? I mean, you were there from the beginning. You know the spirit of the law. You know the detail of the law. You know what's happened over 26 years in both industry and consumer behaviors and attitudes. What do you think? Is there an opportunity and a need for modernization? And if you do think that's the case, what part of it should the focus be on? And if you don't think so, why not? Loren, I guess I'll start with you.
Well, I'll defer to Scott because he has strong views on this, and I think, Scott, you ought to lead that, and we'll follow.
For today's talk, I try to think back, what are the fundamental assumptions we have now that weren't true then? Number one, we now know that these products work because people wouldn't buy $40 billion of them otherwise. And as Loren said, it's gone global. Number two, we know that the industry has refused to come up to its obligation on safety. So something has to be done to force that. Number three, there's been a major cultural shift in supply. When we passed DSHEA, meaning Trish and the staff, almost all the raw materials came from either Utah or Germany and Switzerland. Now they're all from Asia, and I commend to everybody, if you haven't read it, the book Bottle of Lies by Catherine Eban, if you want to know what the mindset is in Asia that drives the concern about raw materials. And finally, there was no internet, as Loren mentioned, 1994, and that also drives the way things are sold. So I think in fixing it, the first thing we need is a mandatory registration. We need to give FDA a list of what's on the market. Right now, they're shooting blind in a million directions because they don't know what's out there and what they should focus their enforcement efforts on. Number two, they need more money to enforce. We've heard a lot, even with an FDA that we found very credible and willing to work with the associations. They don't have the money or the personnel to go after a lot of violators. And that goes from everything to tainted products, supply problems, and also companies that are riding on the coattails. The companies that are investing in innovation and safety are not being rewarded because they have, bad players coming in, not filing NDIs, and FDA says they can't enforce. So it's a problem. And then I think the last part, and I'll shut up, is FDA has a residual interpretation, it goes back to 2004, that's really holding back progress on the regulatory front and is creating more mistrust. And that is in section 201, the definition of other substances. To Loren's earlier discussion and Trish's, we very purposely drafted it to say, we don't know what's going to come out. As long as it meets the safety standards, FDA should permit it. There'll be an NDI. Well, that's not happening because FDA is saying if it's not nutritional, it's not another substance. That's the opposite of the way Congress actually took out the word nutritional there, and we need that fixed.
So, John, I'll follow on a couple of things that 26 years later, intellectual property protection is something that is a commercial problem. A lot of companies are willing to invest resource to do research. They have to be able to protect it in some fashion. It's difficult for natural products. Mandatory listing is probably the one issue that is most prominent in that DSHEA 2.0 discussion. Our view is that, let's see the specific language and then we can come to terms. The reality is that most everybody has a website, most everybody has a public presence. Most of what FDA would like to see is already in the public domain. What the agency says is we need a more convenient way to to know who's in the market. If it's true that there are 75,000 products, we just like to know what they are. I think the third piece is structure function claims. You can hear a lot of interest in expansion of structure function claims to allow more communication of truthful information that goes beyond just structure and function. That 26 years of research, 26 years of expanded knowledge, as well as a changed consumer that is vastly more informed, that has far greater access to information themselves. In some respects, we kid ourselves to believe that the consumer can't find whatever they want in 5 minutes online. In that case, we ought, as an industry, be able to try and communicate what we believe is the most, I would say, valid and truthful information we can in a world where there's a sea of knowledge that's sloshing everywhere. I think there's an imbalance that we need to really look at in that respect. I say all that with great concern, is that if we open up DSHEA, that mischief could be done. And that we have for decades felt that it was not worth the risk to do so.
Just to add to that a little bit, we don't know who the next FDA commissioner is going to be. We don't know what the Biden administration will say about supplements when they get to that part of their agenda. So I think we have to be really careful about what might be referred to as opening up the act in a broad way, because we could end up with some things that we really don't want. Certainly, mandatory listing is very close to ripe. The industry has discussed it a lot. Many of the companies do it already overseas. There's a rumor FDA has a bill written of their own, which may or may not be the same bill it would be under a Biden administration. So, there may be a basis there for moving something. I just note that there have been a lot of issues with specific supplements lately, and we struggle with a way to portray them as not characterizing our whole industry, because it's easy to get publicity about bad news, but not so much about good news. So, we have to be very careful as we move forward. We don't have a Harkin or a Hatch in a position to help us now.
Yeah, so in the alternative of modernize bill, is there another way to address the issues that Scott had talked about, and you to a certain extent, Loren? Can the industry do something itself? I hate to use this word, but self-policing more, or is there an alternative? And if not, does that take us back to the need to try to introduce a bill without losing too much? Do we have a choice, I guess is my question.
Some of these things would need to be done statutorily to really make them work. For FDA to do it by administrative action is slow, complex. Ultimately, it probably doesn't achieve the level of force that is needed on some of these specific issues. The real problem we face is that the industry has become two industries. One that has really adopted the fundamental premise of safety, science, quality, and do beautiful work. They really, really try hard. There is another part of the industry that has become exploitive and by and large operate on the internet. And they're incredibly difficult to find and stop. That's the part of the problem that you'll never resolve, no matter legislative or administrative action, is that they come and go with one view, is to make money quickly and then exit and move on, do harm to us in the meantime. Our biggest problem is how we deal with that faction of people. I don't regard them as being in the dietary supplement industry. I just regard them as passing through town and shooting the place up before they rob a bank and go.
To its credit, the industry, by and large, the trade associations have been advocating for more resources for FDA, partially to do just that, to police the industry, because it gives us all a bad name when people distort the law in the name of dietary supplements. If you watch late night TV, you see these ads for things and you're like, they're calling it a supplement. Oh my gosh, what do we do?
Right. Scott, any other thoughts?
Well, yeah, before we wind up, I just want to say, first of all, thank you to you and CHPA for convening this podcast. And second, to Trish and Loren for bringing back so many insights that are so critical. And it's nice to know that the two of them are so active and are important voices now, because I think that I have a lot of hope that the right thing will happen. And to Loren's point, it can't all be industry self-policing. So when the language is proposed and people can look at it, the fact is, as Trish was saying, that you have to look at overall how the industry has done, and it's pretty good. And so I think at this point, my fingers are crossed that by next year at this time, we'll have the bill and we'll have some agreement among the associations moving forward.
Well, I have to say, thanks so much for the time and the insights that you share. I think that a fantastic industry owes the three of you a great debt of gratitude for the work that you did and continue to do in this category. I know the difference that you've made in so many different companies and actually so many individual careers who've made a career out of the dietary supplement category, including myself. I want to thank you guys. And to see and have a better understanding of the insights and the underbelly of getting legislation through that Tricia and all three of you guys work together to make happen. I'm hopeful that something like that can still happen in today's government and bring that about. But I got to ask you guys one last question, especially in 1994. What you guys achieved back then was a monumental task, right? What did you do to celebrate? Were you shocked at it, or did you go out someplace and do it? I've gone to a lot of conferences in the last 26 years and had a chance to hear, all of you talk individually, but I never heard two things. I never heard the full story that we have here today, and I never heard you talk about the celebration part of it. There's got to be a story in there someplace.
Yeah.
Scott and Loren and I celebrated it last year pre-COVID at a very nice meal.
We did. We had Peter Reinecke with us, who's
Latest you realize you should celebrate? Oh.
Well, yeah, delayed. It was. We really had a great moment. Peter Reinecke was Senator Harkin's health policy staffer. Without Peter, I don't think DSHEA would have passed. So the four of us got together, and it was a very special moment. That the fact that we were all still involved in the industry and all still here on the planet is not unremarkable. I remember what happened is that we were sitting in the Senate, the help staff lounge, watching the TV as the bills were being read through, and it was ticking past 11 p.m. And our bill was not coming up. And there's a whole other story of what happened. Senator Metzenbaum put a hold on it, and there was a bit of a skirmish on the floor to break the hold. But ultimately, the bill was passed. I believe it was 11:24 p.m. And this is after days and days and days of intense negotiations. I was staying at the Hyatt Hotel just off Capitol Hill. I remember just shaking hands with the folks in the room and said, well done. We were just too tired to do anything more than that. I got back to my room. There was a little fridge with a mini bar. I got out a little half bottle of Spanish champagne and sat on the bed and thought, who do I call at this time of night? And I called one friend on the Pacific Coast just to say, you won't believe what just happened. And then I just fell back and fell asleep on the bed.
And in a certain sense, it was kind of anticlimactic because we thought it was dead until that call from Richardson's staff who said that Waxman was going to offer us a draft. And so, in my world, it was still the end of the session, so I had to keep working, and we'd been up all night, and But I don't recall that we ever, until literally last year, did go out and celebrate, did we? I don't remember that.
No, I think we just kind of went back to work. We had just worked so hard, and when it happened, it was hard to explain. because there were so many moments that we thought this was done, it was dead, and I think I think emotionally I was afraid to have too much hope that it really was going to pass, for fear of being so disappointed one more time.
Well, it's an awesome story. What a great experience. It's nice to learn the full story now, and thanks really so much for the time and sharing it with our listeners. I hope for those of you listening that when you see Patricia Knight, Loren Israelsen, or Scott Bass, you at least buy them a drink and say thank you. Thank you to you all.
Thank you for joining us here at CHPA Chat. For more information and to hear our entire catalog of shows, please visit chpa.org.